Hi everyone, this is Dr. Devin Barley with Greenwich Chiropractic, and in this video series we're talking a lot about spinal stenosis. Now, some of you may have heard this term, some of you haven't. So when we're talking about spinal stenosis, basically what we're talking about is room. There is a lack of space for the spinal cord and the nerves that exit out the spine. And this can have no symptoms, but a whole host of really bad symptoms as well. And I think the important thing to do is to talk about the anatomy of what's going on as it relates to spinal stenosis. So when we look at a normal spine unit, that is the bone above, the disc in the middle, the bone below, that creates a bunch of room for the nerves and the blood vessels that exit out of the spine. And for that reason, the brain and the spinal cord can communicate with the rest of the body effectively. With spinal stenosis, typically the number one cause is wear and tear, degeneration over time, although this could have been caused by something like a slip, fall, or accident early on, where the spine starts to deteriorate. And when it starts to deteriorate, what we see is that the bone actually starts to get mottled and bulky in response to that increased stress or pressure in the spine, and that's what crowds the nerves. So the spine will look more like this. You see all these bony projections. There's very little space for that spinal cord, very little space for the nerves where they exit. And for this reason, people often experience definite stiffness, loss of range of motion. You can have pain, numbness and tingling in your arms or in your legs, as well as weakness. You know, I hear a lot of our spinal stenosis patients say, well, I go from park bench to park bench or mall bench to mall bench, because what's happening is that the power that's getting through those nerves is just not enough to supply or support the body mechanics and movement. And that can both cause tiredness in the muscles, but also increase pain the more that you use them. So what we do here in the office is based on what the anatomy looks like. So with a careful consultation, exam, and x-rays, we'll be able to determine the level of arthritis and stenosis in the spine. And by doing that, we're able to effectively come up with treatment protocols that can help alleviate some of the symptoms. To be clear, the bone spurs, the bone itself is not going away, but what we need to do is create more wiggle room for the nerves, and by doing that, we can slow down the process and also get you feeling better. We do that through chiropractic manipulation, which is great to get mobility back into the spine. That mobility and function helps pump out things like swelling and inflammation. But we also utilize something called decompression therapy, which is going to stretch and exercise your spine. And what it's going to do is it's going to separate the bones in your spine very gently to almost create a vacuum where we're going to draw fluid into the disc and open up the space so that that nerve can send more signal through. And by doing that in little bits over time, we have a lot of patients who get great relief from these modalities. So if you're suffering from spinal stenosis, number one is to know the anatomy, but number two is how to treat it effectively so that you can get results without things like injections, drugs, or surgery, which is oftentimes the case when you go down the road with spinal stenosis. So thank you so much for listening. We'll see you on the next video.